think actually as a word it's a difficult word because it sounds like jargon, but actually what it's really about is making sure that we're involving people who are using services and their carers in the decisions that we make about the way that we do our work, how we develop the products and services that we provide.
It can mean decisions on your own care. It can mean about what's happening in the environment you're in. It's bigger stuff around strategies of big organisations like hospital trusts or social services in how they deliver services.
There's been a kind of journey that we've all been on in terms of completely disregarding the views of people who are using services, to talking to them and thinking that was okay, maybe consulting after we'd made our minds up, but actually increasingly what we're doing is thinking about involving people before we've made decisions, actually having them influence what those decisions are.
It is about being at the table early on in the process and just inviting, or people feeling they can say what the agenda should be.
It might be tough, it might be even tougher now than it used to be, but actually that's no excuse for us to kind of hide behind our desks and think we can just get on with it because it's all too difficult and we shouldn't bother people. Actually, sometimes the way to improve services and the way to spend money in a much more effective way is to actually properly engage with people, because if you're doing the things that they need and want, then actually that might be a cheaper way of doing it in the end.
It is about that shift in power and that people feel more ownership about what goes on and they can influence that and really have a say and also help lead some of this stuff, so we can work in partnership with organisations and staff like SCIE, but also other social services across the social care sector, and really ground what happens in people's lives and really making it meaningful.